Hello and welcome. We'll get started right at around 12:30. Hello, everyone, and welcome.
Hi,
Thank you for
everyone.
joining us today.
Julie, I'm going to go ahead and get started if that's okay with you. Since it's 12:30, thank you so much for joining us today. Ariana Nieves is my name. I am the Senior Regional Sales Director for Kaplan, and it is my pleasure to introduce Julie Hamilton, who is our nurse consultant. Julie comes to us with tons of experience after spending over a decade as a Kaplan NCLEX instructor, tutor, national faculty trainer, and content developer. She has 30 years of nursing experience. Julie has served in many different areas, including program chair, establishment of the new nursing programs, developer of course curriculum, and an active faculty instructor for PN, ADN, and BSN programs, teaching in the classroom, skills lab, and sim lab, and clinical practice rotations. So without further ado, I will hand it over to Julie.
Thank you, Ariana. Welcome, everyone. It is so great to have you with us. It's such a pleasure to be in front of you and sharing our webinar today. We're going to talk about developing practice-ready nurses, CBE strategies and solutions. I'm not the only nurse consultant in the room with you today. We also have Dawn, and Dawn's in the chat. So feel free if you have any questions to submit them in the chat, and Dawn will respond. We will have some time at the end of the presentation for some Q&A as well. So let's talk about our roadmap. So today's roadmap, we're going to do a brief walkthrough through our structure and provide guidance and decrease the overwhelming feeling of maybe feeling overwhelmed and being felt kind of lost in this kind of CBE world. So we're going to establish the why. Why CBE? That's kind of our problem, kind of in our brain that we think about. Why should we do CBE? We're going to review the what, and that's the framework and decoding CBE, for example, using our AACN Essentials, and focusing on the how. So that includes CBE strategies related to the curriculum, assessment, educator partnership, and collaboration. So now let's look at our objectives. Our objectives are our measurable goals for the session. We encourage all of you to reflect on your program's current status relative to these points. We want to highlight and break down the key verbs. So let's analyze rationale for competency-based education models, really looking at understanding the need. Identify strategies for mapping curriculum to CBE, so kind of recognizing that framework, and design authentic assessments to measure student competency. That's creating solutions. And we're going to formulate a plan for academic and practice-based experience partnerships, which is that planning implementation. These objectives demonstrate how we are moving from understanding to action. And that's the same thing we want our students to do. So let's look at our imperative, the shifting focus. Why CBE? Well, we know there's a readiness gap. Research indicated that entry-level nurses frequently lack the necessary clinical judgment skills required in increasingly complex healthcare environments. There is currently an industry need for immediate proficiency. Let's look at our traditional model. So traditionally, it's been time-based. So historically, we have had heavy reliance on content coverage per the educator versus the actual performance of the students in delivering safe, effective care. The shift responds to a student learning pathway focused on the student and not the educator. So let's look at our CBE model. The CBE model is outcomes-based. It's focusing on demonstrated mastery or competency with measuring progression over time of the student's knowledge, skills, and attitudes. The behaviors required to practice safely and effectively. So we have to have a fundamental shift in nursing education. There is a national call for practice-ready graduates. This call requires change. The National Council State Board of Nursing responded to this call for change with their launch of Next Generation NCLEX and the initiation of the clinical judgment measurement model to measure clinical judgment. Now let's look at the advantages of competency-based education. Learners engage in gathering and reviewing performance evidence, including how to become self-aware through the self-assessment and evaluation process. This occurs with the initiation of collaboration with educators generating their own learning plans to gain and attain the competency. With CBE, students are at the very heart of the learning process. It also makes the learner accountable and responsible for their own development and education. CBE does promote equality through the ability of meeting the diverse needs of learners from a variety of backgrounds and learning styles. For multiple assessors, providing focused feedback using multiple methods, it helps the learner connect the experience with becoming a nurse. CBE provides clarity to understand the development and performance that are needed to take ownership of the learning and individual growth of the student. The real-world relevance is evidence because it is truly preparing students for the nursing profession through an educational experience to prepare them for practice. It cultivates a stronger relationship between the faculty and the student, as all faculty are able to truly coach and mentor as the learner develops and transforms into a professional nurse. CBE helps promote a collaborative community of shared goals and expectations. CBE promotes practice readiness for the learner, as there are continuous opportunities for mastery. Through this process, the learner builds confidence to demonstrate the competency effectively. So let's look at the AACN. The AACN Essentials include 10 domains encompassing competencies and subcompetencies for competency-based education. Their website has a lot of resources for educators, including a toolkit. The outcome-based framework for critical curriculum design is focused on progression and a gradual increase on the expectations of the learner. The competency-based education model more strongly aligns with the structure of the Next Generation NCLEX through its emphasis on clinical judgment. And let's look at maybe what you already have established and how do we transform or how do we shift? The American Association of College of Nursing, AACN, Essentials Competencies, and the Quality and Safety Education for Nurses, or CUSN competencies, are highly related frameworks that guide nursing education, with CUSN being largely integrated and foundational to the AACN Essentials. So when we think of CUSN, we're thinking more of that safety, quality and safety, and that's a domain within the AACN Essentials. The AACN Essentials provide a broad, comprehensive, competency-based framework for all levels of professional nursing education, the baccalaureate, the master's, and the DNP, while the CUSN competencies are a more focused set of 6 core concepts specifically designed to ensure future nurses have the necessary knowledge, skills, and attitudes, or those KSAs, to continuously improve the quality and safety of the healthcare system. Now, I designed this slide to be kind of basic so you can compare and you can easily see how we can shift into the AACN Essentials. This is a screenshot of the available resources at the CUSIN Institute, and it provides an easy crosswalk to demonstrate the alignment of the competencies related to teaching strategies, mapping of courses and curriculum, and the general understanding of the essential domains and concepts. Dawn's going to provide a link in the chat for you so you can check out this resources. And it's a great crosswalk to go from CUSIN to AACN. Now let's look at our strategies. In strategy 1, we're going to look at curriculum mapping for competency and mastery. This is the foundational step. The goal is to move from course objectives to competency progression. A backward design is a framework rooted in an intentional approach and the principles of learning. The first stage is defining the outcomes and the essential level competency. The second stage is determining evidence that is acceptable, and the final stage is encompassing the learning activities that are meaningful and relevant for learner development and nursing practice readiness. The competencies should be consistent and clearly defined vertically and horizontally throughout the curriculum. Clearly plan and map specific learning experiences and activities to the competency and cluster for efficiency. So as an example, instead of teaching pain management in a single class, map the competency. So for example, for the AACN domain 1, patient-centered care, make this across multiple courses, escalating in complexity from simple assessment to leading an educational class or an interprofessional pain conference. Flip that classroom where students are teaching and presenting the information, skills, attitudes, and behaviors. Our strategy 2, an authentic assessment measuring what matters. To effectively prepare future nurses, nursing educators must evolve their approach to student assessment, moving beyond just a reliance on traditional performance matrix. The focus should shift to a comprehensive system that facilitates the demonstration of competency and supports continuous improvement. You want to offer a variety of assessment measures. Utilize a diverse range of assessment instruments to provide rich, individualized feedback. This variety is crucial for catering to different learning styles and fully evaluating the breadth of the nursing skills. Integrate formative assessment and feedback. Employ formative assessments consistently throughout courses. These should be coupled with timely, constructive feedback to allow learners to track their progress and make ongoing improvements, thereby preparing them for successful course completion and the summative assessment. Track their progress over time with analytics that demonstrate trends of remaining steady, or there's an increase or a decline to provide a longitudinal evidence of obtaining that competency. Prioritize competency-based assessments. Assessments must require students to actively demonstrate competencies and align with real-world practice. Examinations should include case-based items and priority decision-making with evaluation of the 6 cognitive domains operations of the clinical judgment measurement model. Focus on the shift to performance-based assessments and evaluations, not just what do you know. The use of consistent standardized rubrics and the importance of inter-rater reliability among faculty and clinical educators and preceptors is important to define the expected competency at each level of progression. Not only do you want to specify the learning activity with the competency, but also the assessment tool and even that specific question you are using to validate if the competency has been achieved. By adopting these principles, educators can create an assessment system that not only measures learning, but also actively drives the development of competent, practice-ready nurses. So let's kind of look at that assessment framework components. A competency is the sum total of everything a professional needs to perform their role effectively. Think of this as a four-legged structure. Think of the knowledge, the what, and the why. Think of the skills, the physical or cognitive how-to. Think of those values, the ethical foundation that do no harm, and those attitudes, that professional demeanor and mindset. You can't stand on one leg alone. If a competency is a broad goal, for example, practices evidence-based care, the subcompetencies are the specific, observable actions that prove the student can do it. Subcompetencies must be written so they are measurable and observable. Think of our SMART goals. This is crucial for faculty consistency. So for example, instead of saying communicates well, a subcompetency assessment would be synthesizes complex patient data into a concise SBAR report. This gives us a clear behavior to watch for. Competency isn't a light switch. It's a developmental path. Progression indicators are the mile markers we use to track a student's growth from a novice to a competent graduate. Think of these as developmental milestones. We have to roll over, then we crawl, then we walk. So for example, a year one indicator for a skill might be performs the skill with supervision. The year four indicator would be performs the skill independently and teaches the skill to others. This is essential for ensuring we aren't just measuring success in one course, but tracking continuous development across the entire program curriculum. Learning experiences should include both forms of assessments. The formative assessment is the assessment for learning to determine opportunities for growth. Think of these as tests as tools and activities for learning. The summative assessment is the assessment of learning and verifies if the student is ready to progress to the next level. Let's take a look at our third strategy, integration for evaluation. This slide focuses on three key strategies to strengthen your nursing program's competency assessment and data utilization. All forms of measurement must be psychometrically sound, reliable, and valid. So let's look at educator training. We want to standardize competency language and evaluation rubrics. So let's look at the why. Address the current challenge of variability. Different instructors often use different terms and standards for the same competency. This lack of clarity creates confusion for students and makes program-wide evaluation difficult. What's the what? We need to establish a shared precise language for every required student competency. So for example, going back to our communication example, instead of shows good communication, define it as effectively uses SBAR format to communicate patient status during a handoff. Be clear, concise, and precise in describing the required action or behavior. So let's look at our how. Develop and utilize standardized evaluation rubrics across all courses and clinical settings. Rubrics must clearly define performance levels. For example, novice to advanced beginner to proficient, with measurable behaviors for each level. Dedicate faculty development time to calibrate scoring. Have everyone score the same sample student performance and discuss the discrepancies until a consensus is reached. Work together. We also want to utilize shared data platforms. We want to move beyond paper forms. We need to leverage technology to gain a real-time comprehensive view of student performance, academically and clinically. There's power in real-time data. So with implementing a shared data platform or a platform with robust analytics, it allows us to track student progress, instantly identify which students are excelling and which are failing behind on specific competencies. We can identify program gaps, pinpoint competencies where the entire cohort is consistently struggling, indicating a potential need to adjust curriculum or teaching methods. Think about clinical attainment. When we accurately log, verify, and monitor the required clinical experiences, for example, like the number of IV insertions or Foley placements for every student, this ensures readiness for licensure and practice. There's benefits. This shift transforms data from a mere record-keeping chore into a powerful prescriptive tool for curricular improvement and early student intervention. We want to include dedicated, meaningful experiences for transition to practice. Our assessments must go beyond the simple knowledge recall. They must truly measure a student or a graduate's readiness for independent practice. We want to design these dedicated, meaningful experiences like simulation, complex case studies, or structured capstone projects that require students to synthesize multiple competencies. These are just not learning activities. They are competency-based assessments. Use these experiences to evaluate how students transform and are transitioning to practice. Assess their ability to prioritize, make safe clinical judgments, and function effectively under pressure, mirroring the reality of a new graduate nurse. This also includes taking examinations. Here's a suggestion. Consider involving partners to help support your initiatives, vendors, hospitals to co-develop or provide nationally normed data to validate the assessment scenarios, ensuring they reflect current employer expectations. And the last slide that I'm going to share with you today is all about technology and leveraging technology solutions. We need to modernize the nursing education and use key technology tools. Consider e-portfolios. Consider this the competency hub. Think of the e-portfolio as the single source of truth for student competence, just as we have with client records. The up-to-date information to identify gaps and opportunities for growth. They centralize evidence required for meeting all program and professional competencies. They easily track, assess, and document how students are progressing against standards, making accreditation and review processes much smoother. There are many free and professional online platforms that are available, including WordPress, Weebly, and Google Sites. Think about adaptive learning systems and personalized pathways moving beyond one-size-fits-all instruction. These systems create personalized student learning pathways. They adjust content difficulty and sequence based on the student's real-time performance. They provide highly individualized feedback automatically. This frees up instructor time and ensures every student gets exactly the instruction they need, precisely when they need it, targeting the knowledge gaps and efficiency. An example of this could be an AI tutor. Let's talk about virtual experiences. Virtual experience standardize clinical judgment, enhancing clinical readiness in a safe, scalable environment. They deliver standardized clinical judgment scenarios, and every student experiences the exact same patient situation, ensuring equity in exposure. It allows for repeated practice and assessment of critical thinking skills without risk to patients. They offer a great way to assess how students apply the National Council State Board of Nursing clinical judgment measurement model in a controlled setting. Let's look at data analytics. We want to be accreditation ready. Using program data proactively, not just retrospectively. Data analytics tracks competency for accreditation purposes in real time. It provides actionable insights into where the curriculum is strong and where students might be struggling. It allows programs to generate required reports effortlessly and prove that graduates consistently meet educational outcomes for bodies like CCNE and ACEN. Wisdom takes time. Competency takes time. It's just not what our students know. It's about what they're transforming into becoming. We have an awesome opportunity to guide them in that path forward. I'm going to now shift our focus to Ariana, and she will go over some slides with you.
Thank you, Julie. I would love to talk to you a little bit about how Kaplan could support everything that Julie just mentioned and how our products could help your students. So Kaplan's products help program measure student progress against emerging competency standards, such as the AACN Essentials. We have two different products. One is our integrated testing product, which is for RNs, and they have been tagged with the AACN competency domains. This allows faculty to use educator reports to see how students are performing at the domain level, identify concepts that they are struggling with, and adjust instruction as needed. We also have a second product, which is our virtual clinical simulation, which is iHuman Patients. And iHuman Patients platform really helps students develop those clinical judgment skills, decision-making skills through realistic patient encounters. It also helps programs meet accreditation standards, including the AACN Essentials. On this particular screen, what you are seeing is an example of an image of one of our Kaplan questions and the incorporation of the AACN competencies to each question at the granular level with an individual item. We also have an amazing reporting suite. That reporting suite features over 80 categories, including AACN essential domains and accreditation categories. On the left, the categories are displayed, and as you move to the right, you will see the norm results and the percentage of points earned by one student. Category comparison reports are available for each student and for cohorts. This data can be managed for analyzing one test, combined test, or for overall performance on all tests. These features allow you to monitor and track progress in real time and over time to identify trends, gaps, and opportunities for growth. This screenshot is an example of additional categories for cognitive domains of the clinical judgment measurement model and concepts. As you move to the right, you will see that the norm results and the cohort performance. Kaplan products help programs measure student progress against emergent competency standards, such as the AACN Essentials. Like I mentioned before, we have a virtual clinical simulation program, which is called iHuman Patients. And this is going to help students develop their clinical judgment and decision-making skills through realistic patient encounters. It also helps programs meet the accreditation standards, including the AACN Essentials. But the best part is that we've already done the work for you. This is an example of the crosswalk for our iHuman Patients virtual simulation for one of our premium cases. And this, as you can see, is one of our graduate, and sorry if the lettering is really small, but this is actually for one of our graduate cases. Each column represents the competency and the domain for the AACN competency and the AACN concept. In addition to the AACN competency, it includes ANCC, FNP board certifications, AANP domains and tasks, and AANP knowledge areas. Notice the clustering of the domain subcompetencies and the recognition of the behaviors that are expected. And I also want to just let everybody know that we have many faculty resources available. We have a continuing professional development library that is now available for faculty. We also have expert consulting and support. And, you got to meet one of those great support people, which is Julie Hamilton. But we are here to give you all that guidance. We also have research and thought leadership. There's different topics that are listed there, but many great resources available to faculty. You could see here the QR code. If you do want to get more information about any of our products, please feel free to use that QR code to go ahead and set up an appointment with a Kaplan representative. And I think we have a few minutes left for questions. If there's any questions that you would like to direct to myself or to Julie, please feel free to ask those now, or if you want to include them in the chat.
Yes, submit your questions in the chat, and Ariana and I will answer those, or Dawn can also answer those in the chat as well. We want to thank you all for attending today. It is great to be able to share this information with you and all the great resources that we have at Kaplan to help you meet that need with CBE.
I'm not seeing any questions at this point.
Okay, well,
There is a question. The webinar is recorded, and that recording will be accessible on the portal in 24 to 48 hours usually.
Yes, great question. It is recorded and it will be available generally within 48 hours, as Dawn mentioned.
Julie, I don't see any additional questions at this time. But please feel free, like I mentioned, you could use that QR code if you do want additional information outside of this webinar. And just provided you with the recording that will be available later for you to review this webinar. And we want to thank you once again for joining us today.
Yes, thank you, everyone.
Great job, Julie and Ariana. Great job.